my one of my failings in the beginning was like I worked with doctors from the AAOMC, and I was used to everyone having everything buttoned up and in place. Like, so go more into the inclusive program if you can, because I've been in practices where they kind of everything is in more of like a la carte kind of model where they're just like charging for individual things. They're not charging enough, which is a constant theme. And they're like kind of squeamish about making like one fee, and what does an inclusive program look like? So if you can go more into that, that would be awesome.
So, before I joined the practice, they had started that because I went to Dr. Despediti's class and tried to take some similar things from his lecture that he does. Um, but when I joined, we started adding that in. And this year, the previous few years, we've made it to where it's the same price for any of the therapies we're working with. Now, something that I like about that is it price is not dictating the treatment that the child is getting. Um, so if we are on, let's say, atropine, and we're seeing that it's not effective enough for that case, and we want to add Stellest, we're not charging the patient anymore. We're trying to do what we can to include that. But we do a fee that includes all of our follow ups and all the therapy that they're needing. We also include their annual exam to make sure we're not missing anything. Um, but we're seeing these kids every 3 to 6 months, depending upon how they're growing and how well we're controlled. Of course, after the first couple of years, it's a lot easier because we know how their eyes are, and I'll explain that to families. I know your eyeballs. We'll get to really know each other in that first 2 years. After that, I know your eyeballs, so I'll know if we're doing a good job or not, and we'll get to space things out, and it equals out to a much lower fee too. But this past year, we actually involved Treehouse Eyes within our practice. And the reason we were trying to see what are we missing and what are we missing with communication within Kansas City area with our marketing too. So we're still new within that, but they do something similar with pricing.
Mhm.
So
So it allows you to one of the things I made a note of is like it allows you to pivot, which I think is such a great point. Like if one treatment is not working, it allows you or you want to bring in a different element, um, it allows you to make that change because I think that's such a great point to make. Like, I think there's a lot of like apprehension around like, well, I don't know if I feel comfortable charging this much for, a program that is basically just atropine at this point, or maybe it's the Stellest lenses. But like, that's such I love what you said because it's like not everything works, right? Like
yeah,
right off the bat.
yeah.
Um, so I
Well,
love
and
that.
then they get older and their needs change and their compliance changes. I've had so many kids that maybe we started an atropine and they were compliant the first year. And then we are pushing them, we're seeing them closer because their axial length's grown and they're not using it. And we got to change something up. And now we're involved in sports and we're doing all these activities. So ortho-k or soft lenses, it becomes a better option for them. So it's a balance to kind of see, okay, what's going to be most effective, but what they're going to be compliant with too.
Hmm.
Which has always been the biggest surprise for me is just compliance. Even though their parents are there, compliance is not always there. So you always have to watch.
Right. Yeah.
But I
Compliance
think
is
of it,
like one of the biggest factors of I think what we're seeing with Stellus, right? Like the prescribing the anti-myopia spectacles, but not you don't know where they may have gotten that prescription from. I know a lot of docs have seen patients that have come in have gotten the spectacles somewhere else and they don't know how to wear them and they don't know to wear them like all day
yeah,
every day.
yeah.
So yeah, it's a great point.